All healthcare workers will have to get a booster by February 1st and be tested twice weekly in the interim. So what does this mean when it comes to healthcare workers in our area? Action News Now reporter Jordan Henry breaks down the local impact.
Shasta Community Health Center already lost staff due to the first mandate. But for many healthcare workers here, getting the booster is about protecting their patients. Irina Raybeck has been a registered nurse for 14 years. She says she got the booster because her patients have a higher risk of getting COVID.
I personally chose to get vaccinated. I have a small child at home, and I work with a population that is high at risk. All our pregnant patients are. I felt that was the prudent thing to do and get the booster.
Raybeck says she felt she needed to get the booster because of her work with expectant mothers.
The booster is definitely needed because our pregnant patients are more at risk to get COVID-19. So their immune system is slightly lower when they're pregnant, so more likely to get COVID.
Laura Dugan, Deputy Chief Operating Officer at Shasta Community Health Center, says some of her staff don't want the booster.
We had the first booster, the first shot, second shot. We got through that. We did lose staff. It has impacted our ability to provide service, no doubt. Will this next mandate affect our staffing? Likely. There will be staff who will choose not to get the booster. They may be done.
Elisa Mayberry is not one of those staff members.
It's recommended. We should take it wholeheartedly. We still have COVID patients. We still have our ICUs full.
Mayberry says if more people get vaccinated with the booster, there'll be fewer people needing medical care.
Being a nurse in this community, I have several friends that are nurses in this community that are exhausted. And if people take this seriously and get their vaccines and get their boosters, we might still have healthcare workers that aren't burnout, that want to take care of patients. And we didn't go in this for the glory. We came in this to take care of people.
As for Dugan, she says once the mandate goes into effect, her facility will follow the guidelines.
So we will need to look at a timeline once we get the written notification of the mandate and then communicate to them what timeline they have to get the booster.
Dugan says many of the staff at Shasta Community Health got the booster, but she does expect some healthcare workers will walk away from the job. In Reading, Jordan Henry, Action News Now, coverage you can count on.
Dignity Health says they will also comply with the mandate requiring all healthcare workers to get the booster vaccine by February 1st.